Hello everyone, welcome to our channel. I hope you have all watched our previous video regarding how to properly put on a personal protective equipment or donning of a PPE, in which we have shown you how to put on each part of a personal protective equipment and how to enter into the decontamination unit. Today we are going to present you a video regarding how to properly put off or doff off a PPE. As you remember, Mr. Stephen has already been inside the decontamination unit after donning the PPE. Let's watch. Once you are ready to come out of the decontamination unit, first make sure that you put away all the equipments and things that you are using inside into a secure place inside the decontamination unit itself. Once you are ready to come out of the decontamination unit, make sure your PPE is safe and is not damaged. You can start with your gloves. Look the inside and outside of the gloves. Look carefully whether any tears is there and the inside gloves can be seen outside. And also look all over your PPE for any signs of tear, spillage or damages. If there are any damage, tears or spillages in your PPE, kindly rub the area with appropriate sanitizing wipes or use hand rub solution over a gauze piece. Once you have sanitized your PPE, get the attention of your spotter and ask for permission for coming out of the decontamination unit. Once you have got the adequate attention of your spotter, give them adequate time for putting on their personal protective equipment before coming and helping you doff off your PPE. Do not enter into the outside area without their permission. Every designated doffing off area should have a biohazard bin clearly labeled and should have two designated dirty chair and clean chair, and also a area with proper hand sanitizers. The dirty chair is to be used by the person who is coming out of the decontamination unit for removing the PPE, and the clean chair should be used by the person only after properly removing the PPE. Once the spotter has worn their PPE, they will come out onto the duffing area and give you the signal to come out of the decontamination area. Once you receive the signal from the spotter, then only you should come into the duffing area, not before. Once into the duffing area, follow the instructions given by your spotter. The first thing to do is decontaminate your outer gloves by proper hand sanitization. Properly cover all areas of your outer gloves with the sanitizer and properly wash the hands. Once you have decontaminated your hand, the first thing to remove will be your shoe cover. You can sit in the dirty chair and remove each shoe cover respectively and then dispose them into the labeled biohazard bin. Make sure when you remove the shoe covers, the removed shoe covers are not touching any other part of your body. Now again disinfect your hand with hand sanitizer. Next thing to remove will be the outer gloves. discarding the gloves, the first thing to make sure is that you get a good pinch on the anterior aspect of the gloves and slowly pull it off your hand. Do not pull very hard because the gloves can snap out and spill the contents as a aerosol. Once removed, make it into a ball with the palm of the other hand, and then to remove the other gloves, slowly insert one finger into the inner aspect of the gloves and, like earlier, slowly pull it out. And once pulled out, the gloves should form into a ball with the inner portion of the gloves now facing outward. After discarding the outer gloves, you have to disinfect your inner gloves. With the hand sanitizer, properly do a hygienic hand wash. After disinfecting your inner gloves, you can pull back the hood of your PPE without touching the outer aspect of PPE. Make sure the PPE hood is positioned back to your neck without touching it. Again, disinfect your inner gloves properly. Now you can remove your splash resistant goggles from the head. For removing, pull the goggles forward and slowly pull it backwards over the head and discard the goggles. Again, disinfect your hand. Once you have disinfected your hands, you can remove the surgical cap from your head without touching the outer aspect of the surgical cap. Remove it and discard it. Again, disinfect your hands. Now you can remove the PPE gown. For removing, first remove the tie securing the PPE. Now pull the zipper all the way down and slowly remove the gown by pulling it apart from the mid position without touching the outer aspect through the inner aspect. At this point, your spotter can help you remove the gown by pulling it downwards while you pull your arms out, turning the PPE inside out. Now remove the other part of PPE by sitting down and slowly remove the PPE gown from your body. While removing the PPE gown, make sure the outer contaminated part of PPE is not touching any of your body parts. Once the PPE is properly removed, bundle it up and dispose it into the biohazard bin. Again, sanitize your hand. Once the sanitization is complete, the inner gloves can now be removed and discarded like how we did with the outer gloves. Again, disinfect your hands properly. After disinfecting your hand, you can now put on a new pair of gloves. Once you have put on a new pair of gloves, you can now remove your N95 mask. For removing the N95 mask, bend your head forward and pull out the lower string of the N95 mask. Let it down. Now pull on the upper string, pull up and slowly pull it forward while taking your face back, allowing the mask to fall off to the ground, and now discard it off. After this, again disinfect your hands. Once you have done disinfecting the gloves, you can remove the gloves like how you removed the earlier gloves. Now do a proper hygienic hand wash with a hand sanitizer. Once you have done disinfecting your hand, you can thank your spotter for their assistance and then exit the duffing area. Hello all, I hope you liked our video. This is presented to you by the ATCM Emergency Medicine channel. Let me introduce you to our cast. This is Dr. Manna. She is doing her first year MD residency in Emergency Medicine Department, Amrita Institute of Medical Sciences. And this is Mr. Stephen. He has done her BSc Emergency Technician course and is right now working as a EMT in the Emergency Medicine Department in Amrita. And me myself, I am Dr. Bharat, Assistant Professor in Emergency Medicine Department, Amrita Institute of Medical Sciences. In this time of coronavirus COVID-19 crisis time, we need to take special precautions for our personal safety, and knowing how to properly use a personal protective equipment is of utmost importance. I hope that you have got the idea how to properly don the PPE and doff the PPE with our videos. Doffing the PPE is of very importance, as doffing should be done unless it is done properly. The contaminated PPE can transmit the infection and viruses back to our body. Thank you for watching our video. I hope you all liked it. If you like the video, kindly like,
share,
subscribe the channel.